Ever feel like compliance is more of a hurdle than a help? Today we're joined by Jay Anstine, seasoned healthcare compliance strategist, author of Navigating the Politics of Healthcare, and trusted advisor to leaders across the industry. With over 25 years of experience, Jay shares actionable insights on turning compliance into a leadership tool that protects margins, strengthens culture, and drives long-term value. If you're leading a healthcare organization, this is the insight that helps you stay ahead of risk, elevate your teams, and position compliance as a competitive edge.
Welcome to the Compliance Advantage podcast. This is a place where we help at-risk stakeholders in healthcare transform compliance into a strategic advantage. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you transform compliance into a catalyst for innovation and growth. Remember, compliance pays dividends. Invest today. Welcome to the Compliance Advantage. Today we have Jay Anstine in from Fort Collins, Colorado. Jay, thanks for joining us today.
Thanks so much for the invitation, Ross.
Yeah, we've been in the same circles, I think, for quite some time. And you've been doing compliance, as someone told me the other day, as a Gen 1er, which was like early 2000s.
Yeah,
so.
That's a term I'm getting familiar with too. Yes, I do think I qualify for that.
So tell me a little bit about your history and where you came from and what you're doing today.
Yeah, originally from upper Midwest, and I started out in healthcare back in 1999, was in between college and law school. I knew I wanted to go on to law school, but I wanted to try some other things. Went through a series of backup potential job opportunities, and then eventually I had a friend that was working for a managed care company that was part of a health system. There was a position that was open with the organization he worked for that was in provider relations. And so this particular company was interesting in that from negotiating contracts to making decisions on medical claims to reimbursement, everything was done in-house. And so the position I worked for was provider relations. And so we negotiated contracts and then worked through billing and coding issues and things like that. But what I really liked about that experience was because I didn't have a healthcare experience prior to this. And so I really found that I liked healthcare. I liked that patients were ultimately the customer and the problem-solving nature of it. And so when I did go back to law school, I thought I want to do something with healthcare and law because I don't want to do DUIs. I don't want to do wills and trusts. I don't want to be in a courtroom or anything like that. Yeah. And so it seemed like a natural fit. And so then I worked in legal for a few years through law school and then after, and then eventually I had a position, I got cut from a budget standpoint, and then that opened my doors to compliance. So I've been in compliance since 2005.
Really?
Yep. And then since then have worked on the provider and the managed care side, largely with hospitals and health systems, but I did spend some time with some physician-owned entities as well and physician practices.
Got it.
I just have always loved the nature of the work, and it's been a better fit for me and enjoyed the problem-solving piece of it. And
you own your own firm right now for compliance consulting? Is that how you
I do some part-time consulting through Bluebird Health Law Partners and largely around either small type projects that come up with regards to compliance program functions or compliance coaching is another area that I've gotten into, trying to help compliance officers interact with their leadership teams and physicians and other clinicians.
Let's talk about that a little bit too, because I know you came out with a book, Navigating the Politics of Healthcare. And this is really a compliance officer's guide, right? To how to communicate, how to build a relationship, or even, do great things as a compliance officer, which is very much what we promote too, because there's compliance officers and then there's compliance executives. And we find there to be a substantial difference between the two. And sometimes the compliance officer role, at least historically, someone who's been in compliance for a couple of decades knows this, that we often get a little bit of a bad rap when it comes to it, but I think it's all self-generated. So tell us a little bit about your book and when it came out and what it talks about a little bit.
Sure. I wanted to write a book for a number of years and kicked around some different ideas and things like that and couldn't really get something to stick. And then the idea really came from when I was working for a physician-owned practice, and it was a joint venture. So we had the hospital kind of in the middle, and then we had the various physician owners, none of which got along with anyone. And so it was very political. And then a lot of times I was kind of stuck in the middle trying to navigate the compliance program or implement new regulatory requirements and things like that. And so that's sort of where the political thing came from. And then for a number of years, I did speak at the Compliance Institute on a lot of sort of soft skills topics about building relationships and effective communication. And I had a lot of chief compliance officers coming up to me afterwards saying, this is great information. Our newer folks really need to hear this stuff. I'm so glad you came to present.
Awesome.
I think after about the third or fourth one on the flight home, I was like, well, here's 4 chapters of the book right here from the last 4 years. So away we went. So I kind of outlined it from there. And then that's sort of what I built upon for a few years. And then it came out in 2023.
That's great. That's great. It's hard to put a book together, and it's nice that you actually got one and put it out there.
Yeah, it definitely was a bucket list type thing for sure.
That's
personal
great.
goals. So,
That's great. That's great. I'll share it with everybody, all my compliance officer acquaintances and colleagues. So that's great. Yeah, absolutely. All right, let's jump into some questions a little bit. So when we talk about kind of leadership and advantages and being you own your own business, you wrote your own book, what kind of books or philosophies or mentors do you have that help kind of influence the way you approach what you do in a business standpoint or even a leadership perspective?
Sure. Yeah, I think a lot of it has been, what I've picked up over the years and working with other, probably more seasoned folks than I was as I went along. I was fortunate in that when I was in between college and law school, I was already reporting and working with the CEO and some of the board members and folks that were twice my age at that point. So I was sort of kind of forced into it. But I liked it, and I got to know a lot of more seasoned healthcare leaders and attorneys and things like that. One thing, for example, that I know I had a hard time with right away at the beginning was asking questions.
Right.
And I always felt like I didn't want to look stupid in front of somebody or say the wrong thing or something like that. And I started to notice very quickly that when I was around more seasoned attorneys, they were very comfortable saying, hey, look, I don't understand this.
Right.
I don't do this type of work. Can you please explain this to me, like somebody off the street or whatever? And so I started to pick up on little cues like that. And then there was another attorney I'd worked with over the years that just had a really good sort of calming presence about him. People would come to him with the worst of type of issues, and he was very even keel about it. And so again, just somebody that I had looked up to over the years and tried to, at least in my mind, think, okay, this is what I want to work towards. So I've tried to focus on that type of approach when it comes to the work. And I think a lot of things that I've written about have been around that, to try and make sure how we're communicating with others is a way that's not sending some type of message that there's a great, huge urgency to something. I mean, obviously we do have certain things that are urgent, but just making sure you use some professional judgment in terms of what is truly an urgent matter and what's not, and being able to kind of see the beginning, middle, and end to a problem.
I love that conversation about asking a lot of questions. And I do feel like there is an issue with compliance in the compliance industry these days. And we talk a lot about it on podcasts and posts that we do, is that compliance officers, even I would say officers, not executives, have this issue with feeling that they cannot ask questions when they don't know the answers to the questions, because a lot of whether it's internal, whether it's leadership focused, somebody has come back to them and says, you must know the answer to all these questions, and if you don't, you're not good. But every general counsel that I know, every CEO that I know, surrounds themselves with people that know. It's a great, I don't know if you like movies or not, but there's a great movie out there, Margin Call. I don't know if you've seen that.
I haven't, but I do like movies, and I'm putting it on my list.
It's the crash of 2008, the housing market, and the one bank got out of all their bad mortgages before it actually went belly up. And Jeremy Irons is the CEO, or the ultimate CEO, board of directors. I don't know what his title was, but he was sitting around a table and he said something, and I'm paraphrasing here, something like, I don't get paid to know all those answers to those questions. So you need to tell me, which you're the expert, you're the engineer, you're the rocket scientist. You need to tell me what those issues are. And it's my job to strategize and figure out how we need to go forward. So surrounding yourself and asking those questions of people that know are huge. And I think compliance should be doing that as well.
Yeah, absolutely. Agree. It's also one of those things that I picked up over the years of, like you said, people not feeling comfortable and not knowing something.
Right.
And I've had to counsel, I don't know how many folks over the years about, it's okay to say, I don't know.
Right.
Just say, I don't know, but we're going to find what the answer is, and we're going to figure it out, and we'll come back with whatever the answer is. So,
no, that's great. That's great advice. All right. Getting into compliance. And again, we're going to talk today about the compliance advantage. And what do we mean by that? There's all kinds of advantages. I know you touch touch a bit on that in your book about how it creates a competitive advantage, and we'll dig into those here in a second. But when you think about compliance in general, what is the common or the biggest misconception that you think healthcare executives have or still have about compliance these days?
Yeah, I think it's just still seeing us as an obstacle, not a business partner,
Sure.
or somebody that's there to tell them no,
Right.
or figure out a way to punish them or something like that. There is that unfortunate misperception. It's probably not helped by the fact that compliance is in our job title. It's probably not the best use of words, but
Right.
I think that's probably the biggest one. I'd say, I mean, over the years, I definitely have seen that change where more leadership folks are more receptive and they are starting to see us more like HR or a CFO or somebody that's there to help advise them to make the best business decision. But that perception is still kind of there. And so a lot of what I try to do is, or tell others to do, is to really just work towards how you're going to conduct yourself in that environment to try and help change that perception.
So talking about that perception, because I agree with you, that is one thing that we should change in this industry. Again, I think we did this to ourselves.
Yeah.
And I think we did it through OIG guidance and regulations when they came out with the federal sentencing guidelines, and then the OIG guidance in the late 90s to 2000s, where they said thou shalt have a compliance officer who's not an officer of the company, who's not a police officer, who's not any type of authoritative action other than a guidance memo that came out to say you shall have a compliance officer. And a lot of people took that as, I need to run around and tell people what to do, what they can and can't do, and you better listen to me or else I'm going to cause problems for you. And I think there's nobody else in a business or any type of industry that acts that way, right? So I think we have done it to ourselves.
Right.
So,
Right.
And so when you think about that perception, how would you do it? How do you change it? How do you make healthcare executives and board members know that compliance isn't just telling you what not to do, but it really can sit side by side with the strategy and make that business grow?
Yeah. Overall, trying to get into that mindset of a business partner and how you can help support them in making the best decision they can. I mentioned the CFO earlier. That's something I've kind of latched onto a little bit lately, that I really feel like I completely agree with, we shouldn't report to CFOs and things like that. So I'm not saying that, but I think our approach to our work is very similar to ways the CFOs are, in that we have sometimes good news to share and sometimes we have bad news to share. And you have to be able to do both of those effectively. For us in this particular position, it's really figuring out how to develop good, strong relationships with those leadership folks, making sure that you understand how things are going to benefit them, maybe not necessarily you or the compliance program, and taking an active interest in those physicians or healthcare leaders about the work that they do so that you really understand their challenges and they feel like you understand their challenges, so that when an issue does come up, they're going to understand that, okay, this person is my compliance officer is there to really roll his or her sleeves up and dig into whatever the issue and see if there's a way we can figure this out that's compliant and business friendly.
When you talk about growing the business advantage with the CEOs, I think that's really important to be able to show that there is a business advantage to that. How does a compliance officer really take that next step to show we're not just a cost center, we actually provide value?
One of the biggest areas I think, or at least keep running into over the years, is we talk about getting a seat at the table and things like that. And so I think that is important when it comes to, for example, somebody wants to roll out a new service line in the hospital, or they want to do a new service in a department or something like that, and making sure that we've got everything in place from a process standpoint. So we've got the medical record documentation that we need, for example, so that everything is in line on the front end before we go live, instead of just going live, not talking to the compliance person, and then eventually an audit or monitoring activity comes around and then we find out, oh, we weren't doing this, that, and the other. And now we have a big payback and things like that. So anything you can do to try and avoid, even though we are, as you said, not a department that's generating revenue for the organization, but at least there's ways we can help save that money or keep those dollars within the organization so they're not getting lost.
Yeah, we call that profit protection. Right. And it's really, even though it doesn't generate revenue or it's not operations based, but it sure does allow us to protect those profits. And when companies want to grow, when they want to venture out into different specialties or different acquisitions, different areas, having that compliance individual next to you, especially if it's a compliance executive, can really help promote that growth. And I think that is really a compliance advantage.
Yeah, absolutely. Absolutely. That would probably be the biggest area that I've seen. There's other things like charge capture audits or other things you could do that helps try and keep those dollars within the organization. But that's probably the biggest area of advantage, is just trying to make sure that we're not going to unnecessarily drain resources, whether it's financial resources or staff time and attention to have to respond to a breach or another type of compliance issue. Anything you can do to try and protect the organization running as efficiently as possible helps with promoting that compliance advantage.
You've been in healthcare and in compliance for a long time. Is there a moment in time where you just had this aha moment to go, wow, I'm not just waiting for things to happen and being reactionary to stuff. I can be proactive because I see this as really a huge advantage for this organization. What was your aha moment?
It's really kind of similar to what I was talking about, where we had a situation that had come up, and some of the aha was with me, and some of it was with one of the hospital CEOs I was working with and the CFO, in that they had moved in, had a new service line start up, started moving forward. They didn't have the documentation in place. We did do an audit a couple of years after the fact, and then found out there was a significant repayment that we had to do. And it was, I think, an aha moment for both of us, in that the hospital CEO and CFO realized the value of having compliance at the table from the beginning,
Right.
and that would have avoided that, having to do that repayment. And then for me, it was sort of seeing that, okay, this is an area where we can really focus on and try and do this as early as we can by way of communicating regulatory changes or NCDs or LCDs that come out from CMS on billing guidelines. If we can do something that is more proactive in approach, to let them know what the changes are and how they need to work to be in compliance with it, that avoids those repayments down the road. And that's the way we can at least show that we have a financial benefit to the organization.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
Yeah, it's almost like a near miss, right? You're just like, oh, I escaped that one without doing it. So we did a good job.
Yeah.
We used to do, in my previous life, we did a lot of due diligence, and we sold our company a few times and went public. And I remember we do a lot of sell-side due diligence with Ronan too. And I remember having a conversation with, it's either outside counsel or someone else doing diligence, buy-side due diligence on us. And the fact that we had everything together, we had all of our packets together, we had all our executive compliance committee materials, all of our boards, all of our audits, all of our policies ready to go, categorized, put up there into the data room. And I remember having a conversation with a counsel on the other side who said, wow, I don't really have any questions. All my questions are answered in your materials.
Yeah.
And maybe I'll ask you general overarching questions, but really I don't need to dig in anymore. This is great. And our due diligence took probably 45 minutes. And other departments were taking 2.5 hours and multiple days to go through their materials because it wasn't clear. It took a person to do it. And at the end of the day, the compliance didn't become a hurdle that they had to overcome, and really became an advantage to a lot of people. And we see that today, right? So we see a lot of buyers on the private equity side come and see a company that we've done sell-side due diligence on and really set up their program. And they go, wow, we don't have any concerns here. Let's move on to something else.
Yeah.
When 9 times out of 10, if you don't have that, compliance becomes the number one concern.
Yeah. Yeah.
And it's really a huge exposure for them. So it really is an advantage to them to get their multiples and not have any reductions in their escrows or anything else.
Yeah. Yeah. And I think just taking that approach from the way you described it too, I think also is showing that you're anticipating questions and things like that. And then that helps with the efficiency piece and helps things. It sends a strong message about how you approach your work and how you do your work. And anytime you can do that, I think that helps on the operational side.
And they start to feel comfortable. They start to feel comfortable that you know what's going on there, and there's not some landmine they're about to step in or a rock they're going to pick up, and who knows what crawls out.
Yeah, exactly.
It happens all the time. All right. I love this question. It's always sparks great interest and great commentary. If compliance was a superhero, what would it be and what powers would it have?
Oh, I would say Green Lantern.
Okay.
I'm going to go with Green Lantern, aside from probably the obvious choices. But I think just because there's sort of the shape-shifting aspect with the Green Lantern, and, because with a lot of compliance officers, I know they're covering different types of services in the organization. They're juggling multiple hats, and, one moment they're having to deal with something in an emergency department, the next moment it's something in rehab or therapy or something like that. You have to have this sort of that ability to be adaptable and change your focus and things like that. So that sort of seems to fit with the Green Lantern, and obviously the money piece of it. So anything you can do to help keep the focus on how to retain that money within the organization.
Great answer. We haven't had that one before. And I like that idea that compliance needs to be adaptable, right? We use an acronym for leadership, and it's called STEADY. And that's what the compliance officer should be, and everything means something. And the A is adaptability, right?
Yeah.
And being able to adapt to any situation that you have is really important. And I agree with you on that perspective. And I also agree that, I always say compliance is compliance, right? It's the same stuff. You have to comply with these regulations, right? And you don't want to violate the law and go to jail or pay money back. But it's learning the specialties and learning the different ones, whether it's cardiology, pediatrics, it's behavioral health, whatever it may be. It's how they apply. And I think that'd be a great superhero, is to be able to say, yes, I can apply the big C compliance program to everything, to any specialties, because I know that I can adapt to whatever's out there.
Yeah, absolutely. That's
a great one.
Yeah. I think, you kind of hit on the point of sort of being adaptable within the different specialties and getting to understand those. I think that is another area that helps too, is just making sure anytime you can sort of demonstrate that, I think that helps from a relationship standpoint too. And I know one of the things I've tried to work on, and I've talked to folks about over the years and employees I've had, is go and do a walkthrough or do the actual work and get a perspective of what the actual work is like. And then you'll understand what the questions are going to be, the questions that might come up, or the pushback you might be getting, or something like that. And so anytime you can kind of put yourself into that perspective, I think it helps. You got to
know the business, got to talk to the people.
Right.
It's compliance officers or executives who don't understand the business that they're in are going to fail.
Yeah.
Are absolutely going to fail without thinking twice about it. So seeing, knowing, talking to people, walking the areas, understanding how they do and why.
Right.
And why is a huge piece.
Yep, absolutely. Yeah, and you start to kind of see where, like I said, anticipate why you might be getting pushback, or like you said, with the why, kind of understanding where they're coming from.
You have to.
Maybe they're having a challenge with complying with some type of requirement. And if you stop the discussion there, you're not going to know. But if you start digging into some of those questions like why and things like that, then you understand, okay, this is a challenge they're having from a technology standpoint or a staffing standpoint. And that's okay. Now I need to devote my attention to that to see if we can come up with a solution.
Yep, I totally agree. If you were going to give some advice to CEOs or board members about fostering this culture, I always talk about culture of compliance, and it's not my preference to kind of talk through that, because I think it's a lot overused. And when they say, oh, you got to develop a culture of compliance. But if you were going to develop that, if you were going to have a conversation with a CEO or a board member to say, how do you foster this culture? What does it mean to them? How would you guide them down that road?
Probably overall, it would be just focusing on the self-awareness piece. Okay. Probably similar. I know you've got kids, so it's similar to the kids are watching, the employees, and how they're responding. If you're having a mandatory training session and the leadership folks aren't there or they're not supporting it, that sends a strong message to the staff that, well, I guess this isn't important.
Right.
And I have seen that happen in the past at some places I've been. And, those were almost verbatim some of the feedback I got from some of the employees. And so having that self-awareness of how, okay, whether it's making a business decision and making sure that we're going to go through the process to include compliance, and we're going to make sure that we're going to do it in a compliant way and a business-friendly way, also sends a strong message, or completing mandatory training, things like that, and making sure their staff are completing it. I mean, those are little things that are more kind of self-awareness things that I think if they're focused on that and how they're conducting themselves in front of the other employees, that I think sends a strong message for having a positive, healthy culture of compliance.
Yeah, and I think integrity goes a long way with that as well. And integrity is a hard thing to define, I think. It's a separation of the difference of morality and truthfulness, right? What you said with inclusiveness of compliance, really having them sit at the table. And then actions do speak louder than words. I think when a CEO does take their training, or they are standing up side by side with a compliance officer or executive, making decisions on that standpoint and doing things when no one's looking, right? I think that's the biggest part of integrity, in my opinion, is do you do the right thing when nobody's looking? Because it's inside of you.
Yeah, absolutely. The other one I was going to add to it was engagement too.
Yeah.
This is something I've seen and picked up on over the years, where some of the best healthcare leaders I've worked for were the ones that were the most engaged with people that did the work they didn't do,
Right.
whether it was compliance or something else. And anytime they're genuinely engaged and interested in the work that you're doing or someone else is doing it, that shows. And that definitely is felt throughout the organization.
Yeah. I read something the other day that said your attitude is contagious.
Right.
And so whatever you do, whether you're a CEO or you're a board, if you roll your eyes when someone says compliance, everybody else is going to roll their eyes.
Yeah.
If you get excited about it and say, no, they're a partner, then everybody else is going to consider them a partner.
Right. Now, I will clarify and say they may not want to read through the 7 elements.
Sure. They don't have to.
Or look at an audit plan or something like that. They might not have that level of interest, but at least they're going to be engaged enough to be proactive and say, hey, this might be a potential compliance issue. Let's bring in the compliance officer or whoever that is, and be more proactive at spotting issues and things like that.
That's a Jeremy Irons reference, right? So they don't get paid to actually know the 7 elements. They get paid to go, yes, we're going to comply with whatever we need to do as a company, right?
Yeah, absolutely.
So they need to lead more so. I ask all my guests the last question here, which is health is wealth. What do you do to take care of yourself?
Oh, definitely outside, active.
Yeah.
I like being outdoors. Thankfully, I have 2 kids that like being outdoors instead of being on screens.
Sure.
And so we do a lot of skiing, snowshoeing, things like that in the winter. We're obviously in Colorado, and then hiking and camping and biking, stuff like that. So
that's great.
Yeah. Anything to be outside.
Where do you like to go?
Most recently, we've been going up to Steamboat quite a bit because it's close to Fort Collins.
Yeah, that's true.
But really anywhere. And then Rocky Mountain, we do a lot of hiking up there, or go up to Poudre Canyon.
Well, that's great. So, yeah. Jay, thank you so much for today. I really appreciate your insights were great. Suggest everybody pick up the book, Navigating the Politics of Healthcare. And I really appreciate you spending time with us today.
You bet. Thanks, Ross. I appreciate it.
Yeah. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.